So tonight we're talking about making your re-entrance, which is what CoolSculpting is talking about right now with their promo. They have a really great promo going on, and we're going to add in our own promo as well tonight. So there'll be 2 promos. And yes, I know some people think it's too early for me to say flatten your curves, but here I am. Okay. All right. So, just kidding. 1 second. Oh no, come on. Okay, so why choose Contour by aNu versus other places? Okay, we have 6, actually we now have 7 CoolSculpting University trained staff. All right, I think that that's really important because you want to go where there's qualified people that are doing this type of procedure. We have a master CoolSculptor, which is Nancy. She's over there in the corner. She's been doing this for several years, and Autumn has also been doing this for about 5 years. Okay, so we have CoolSculptors that have been doing this for a long time. We're a certified Cool Hub. There's only one in the Midwest area around us, in the tri-state area. We're the only one. So what a Cool Hub is basically we were chosen by Allergan to train other providers how to cool sculpt. Right? We get great results. We do a lot of cool sculpting, so they've chosen us as a physician ran and led practice to be a training session for other physicians and other providers how to actually cool sculpt. Okay. We have 2 of these machines, all right, which I think is really important. And we also have a Z-Wave, which I think is very, very important, because what you'll see when his treatment is done is that it's kind of like a frozen block of butter, okay? And at that time, that's kind of when it tingles a little bit. You can imagine like after your arm goes numb and it starts to have that tingling sensation. That's the area where it can kind of tingle and burn just a little bit. But with that Z-Wave, it's gone almost immediately, okay? So what that does, it really helps to enhance the results, but it kind of helps you don't have to hand massage that block of frozen butter. We use that instead. So the freezing and the pins and needles goes away almost immediately. So I think that's really, really important to have versus have somebody kind of hand massage. And that makes the tingling and numbness last a little bit longer when you do it by hand versus having this machine to do it, okay? And studies were done and it drastically improves the results of CoolSculpting. And that is believed because when you massage better, massage more, massage longer with deeper pressure, you get a better, more thorough result. Okay, so by adding this machine on, we get a better result with our CoolSculpting as well. Okay, I think another big thing that's important about aNu is that we are obviously locally physician ran and owned by me. I think that's important to go somewhere where there is a physician on staff and in-house. Okay, if there's ever a complication or a problem arises, my staff always have me 24/7, and I think that's really important. Okay. So the CoolSculpting story, the story that they did the last time was take yourself further. So I decided that this would be me. It was kind of like my get ready answer. I've been, waiting for CoolSculpting for so long that I'm so busy I don't ever get on the machine. Okay. And I know people look at me and they're like, you do not need CoolSculpting, but here's the reality. We all need CoolSculpting. We all have little pockets of fat that need CoolSculpting. Okay. So this is the video that CoolSculpting came out with last year.
You eat right, mostly. You make time when you can. But sometimes life gets in the way, and that stubborn fat just won't go away. CoolSculpting takes you further. A non-surgical treatment that targets, freezes, and eliminates treated fat cells for good. Discuss CoolSculpting with your doctor. Some common side effects include temporary numbness, discomfort, and swelling. Don't imagine results. See them. CoolSculpting. Take yourself further. Save $100 on your CoolSculpting treatment. Text RESOLUTION to 65190 to learn more.
It's a much better deal tonight. It's like $500 or $800 off, okay? But that was last year, and that was when I finally decided, all right, I'm going to do CoolSculpting myself, okay? Busy mom. I have 3 kids. They're not 6 and under anymore. They're 7. Well, that's not true. Doesn't turn 7 until Friday. So I still have 3 kids, 6 and under. Obviously, business owner, doctor. I eat really well. I do functional medicine. I do not work out. Everybody knows that about me. That's why I like CoolSculpting and CoolTone. I just don't have the time, okay? But I really wanted to get rid of my love handles, right? I've never liked them. Even with weight loss, I always had them, right? So
you try hard.
That's me. So when people say you don't need CoolSculpting, can you see that? Yes, I did. Okay. So even Nancy, who did my CoolSculpting, she was like, you do not need CoolSculpting, Kristen. And I said, I will prove to you I need it. I'm going to go in that room. You're going to take my pictures and I will show you that I need it. Okay. This is after 2 treatments. Okay. So that's gone. It's frozen. It is gone forever. Okay. I never have to have that in my life ever again. Okay. That was me laying on this table for 35 minutes because we dual sculpted 35 minutes twice. That's it. Okay, those are great results, and we have a lot of great results. Abdominal results, inner thigh, outer thigh, chin. We have great results, but I think you want to see real people, and I think especially people want to see that the physician and staff have had the treatments done. So yeah, you can get closer to if you want. But yeah, I never have to have that block of fat back ever again. And so people ask, is it permanent? Yes, it is permanent. Okay. So what's the difference with CoolSculpting? So it's proven, it's safe, it's FDA approved, non-surgical, little to no downtime. I mean, you can see how comfortable he is, right? This is what's going on in those rooms where people are like, it's got to be painful. What goes on in that room? That's why I like to do demos, because you can see this is what's going on in that room. Nothing, a whole lot of nothing, okay? And lasting results. So basically, the other question we get a lot of times is, how was CoolSculpting created? Well, actually, they found out physicians started to notice that kids were getting fat atrophy on the inside of their mouth. Atrophy is loss of fat, okay, whenever they were sucking on popsicles all the time. So he really thought there's something to that. Why are they losing fat on the inside of their buccal fold or inside their cheek? And he started researching it. I don't know why, a brilliant person, I wouldn't know what in the world to do with it, but this physician did, okay, Harvard University physician, and started to create cryolipolysis, which is what CoolSculpting is based off of, okay? So literally by freezing fat, you can kill that fat, essentially is what happens. It's called apoptosis, okay? Okay, so we have fat deposits. CoolSculpting uses controlled cooling, just like we're talking about, to kill those fat cells, okay? Literally apoptosis, cell death, which is cryolipolysis. Cryolipolysis literally means freezing fat cells and killing them. That's what that means, okay? In the weeks that follow, the body naturally processes the fat and eliminates these dead cells, okay? I get questions, how does that happen? Lymph flow, so it goes to the lymphatic system, which is our drainage system, and then we excrete it. Okay, and it's not that it changes anything, it doesn't change any excretion or waste or anything from our body, because it happens slowly over the next 4 to 8 weeks. Okay, so CoolSculpting results are long-term, and those cells are gone for good. Okay, pretty cool. So areas that you can do, there's on-label areas and then there's off-label areas, okay? Inner thigh, outer thigh, abdomen, flanks, arms, and chin are all on label. You can also do off-label areas like bra fat, banana roll. Okay, so basically if we can pinch it and grab it, we can freeze it. That's the rule, okay? If it'll fit in an applicator, and we have, I don't know, how many applicator sizes do we have? I don't know. 6, 8? Yeah, exactly, well, we have them all. If I can fit your fat pocket into it, I can freeze it, okay? Which is really, having the mini, which is for the submental area or under the chin, has really expanded our ability to do smaller areas as well, okay? All right, so this is before CoolSculpting and then after. So we are essentially, by the time we hit adolescence, we have the same amount of fat cells that we have when we die. What happens is they get bigger and they get smaller when we lose weight, okay? So we have the same amount of fat cells from adolescence until death, unless we do lipo, we cut them out, we have surgery, or we do CoolSculpting. Those are the only 3 ways to get rid of fat cells, okay? So 2 of them require going under anesthesia and under the knife, and 1 does not, which is why CoolSculpting is so popular, okay? So areas to treat, we talked about that, right? Under the chin, bra fat, abdomen, thigh, inner and outer, upper arm, back fat, flanks, banana roll, okay? How long does it last? So basically what people want to know is, when am I going to see results, and is it going to last forever? Okay, so results are best seen 2 to 3 months after your treatment, but I would tell you start to notice it 3 or 4 weeks, okay? But really at that 8 to 12 weeks, you're at your, that's where you're going to see it the most in photos and in pictures, because it takes time for cryolipolysis to happen, okay? The body has to excrete those fat cells that have died, right? So it takes a little bit of time. But once those fat cells are treated and died, they do not come back, okay? What can happen, right, is if fat cells around it grow, fat cells around it will grow, but not in that area, okay? So I really like CoolSculpting with lipo. Lipo just does strange things. Lipo can kind of cause movement, all right? It can cause pockets to come back in other areas. We don't see that with CoolSculpting. We haven't yet, and CoolSculpting has been out for a long time, okay? So I think that's important. So basically, as long as you maintain your weight in some general area, that fat you will not gain weight. The nice thing about submental is with CoolSculpting, Kybella, some of those permanent fat loss solutions, you would have to gain about 3 to 4 times your body weight for that to come back, which is not going to happen, okay, for most of us. So consultation and treatment day, basically you will go into a room with either Autumn or Nancy or somebody that does our consults. Yes, we will pinch and grab, right? Same way if you went to a plastic surgeon. We have to look, we have to see. So when people call and they want consultations and what CoolSculpting is going to cost, we can't do that over the phone. We have to pinch and grab just like a plastic surgeon, okay? We need to look at the applicators. We need to look at the size. We need to feel. We also need to know what's reasonable for you. Are you a good candidate? What area of your body is a good candidate? Because we want to make sure that the patient gets the best results, okay? So we pinch, we grab, we feel, we mark, and then we decide what's the best plan. How much will that cost? What is the best treatment to transformation? I think it's really important that we sell treatment to transformation packages. That's what makes us a little bit different. A lot of other practices will get you in with 1 or 2 cycles, okay? 1 or 2 cycles is not usually enough for areas to get rid of the fat, okay? We like to tell our patients how many cycles you actually need to go from where you want to be right now to your final results, okay? Doesn't mean you have to buy that whole package up front, but what it does mean is we're going to tell you the truth and tell you that this is how many cycles you actually need to get the result that you want, okay? Instead of, let's do 2 here, let's do 2 another time, let's do 2 another time. You can do that, but we're going to tell you up front how many you really need, and I think that's really important, okay? I won't go more into that. Treatment day, you can read, you can sleep, you can get on your phone, okay? Most people, for me, like I said, just sitting there doing work and answering emails when I was on the CoolSculpting machine. He would probably be on it if I would let him. Okay, female results. This is a chin, this is 8 weeks after. Can you guys see it? Is it an okay angle? Arm, I did do my arms, but this is important. And the nice thing is you don't just get fat reduction, you do get contraction. I think that's important. So we also, that's our job when we do a consultation, is to decide, are you going to be happy with the results if we get rid of fat? Are you going to have some skin laxity there? That's our job to tell you that also, okay? Because we want you to have your best result. And if you're okay, if you have larger arms, if you're okay with a little bit of skin laxity, we will really give you the honest answer of what it's going to look like when you're done, okay? Because we can get some contraction with CoolSculpting. It just depends on how much fat we're getting rid of. Same with the neck. The great thing about CoolSculpting the neck is we get a lot of fat. We get a lot of skin retraction too. Okay, so it doesn't leave you with this excess skin. Right. Abdomen. Can you see it? Abdomen. Abdomen. It's a happy post-baby mama. Yep. That's a very happy post-baby mama. No surgery, right? It's great. This is a very, very, very popular area, which I had done, okay? That flanks and bra fat in the back and in the front. Those areas that are just really, really hard to treat. Not to treat, sorry, to lose weight, to lose those pockets. I always circle this because the first time you look at it, you're like, but these are inner thighs, okay? So you can see that space in between. Inner thigh. And then outer thigh, I guess I don't have a picture in here, but outer thighs, we get some of the best results of anything. There's something about that pocket, that saddlebag, that fits perfectly in that CoolSculpting pad, and we get some of the best results on outer thigh. Wouldn't you agree? Patients are so happy when they do outer thigh. Arms, neck, these are our patients. I don't know. Back fat. You saw mine, okay? This patient went on to actually do more CoolSculpting. It's addicting, okay? Chin. We do a lot of chin. We do a lot of males. Arms, and you'll see here in her picture, if you can see it, that she got some skin retraction, right? That loose skin is now retracted and tighter. It's a nice result. This is abdomen. I have them flipped, I'm sorry. The before is on the bottom and the after is on the top. Really happy patient. I hate that it's blurry. Another patient, she also went on to get more CoolSculpting. Okay. Male results. This is a patient who you would look at, and a lot of plastic surgeons would definitely do surgery on him. I'm not going to argue with that, okay? But this is a patient who did not want surgery, okay? So we always have that conversation with our patients. If this was a gentleman who said I would do surgery, I might refer him to a plastic surgeon, okay? However, this was a patient who did not want surgery. So you have to weigh that into consideration when you're doing a consultation with your patient, right? If they will do surgery and we think surgery is a better option for them, we will absolutely refer you to a plastic surgeon, okay? Because sometimes there's pros and cons to both. But if the patient does not want surgery, right, and just has little pockets of fat, this is an excellent option, okay? But that's what your consultant will tell you, okay? We just definitely believe in giving you the truth and giving you the best of both worlds and giving you that option, all right? Those flanks, everybody wants those flanks gone. This is a gentleman 1 year after. So what you can see is it lasts, okay? Okay, CoolTone, first in Kansas City to get it. We waited, I don't know, almost a year, 2 years, I don't know, something crazy to get our CoolTone machine. It's actually up north. But what CoolTone is, well, I'll show you. Okay, we love her. We did not get very long to use her before COVID closed us, okay? So we used her for a hot minute, then COVID happened, so we were ready to get her back in action, okay? Waited a very, very, very long time for her. We are one of the top 500 in the United States to get it. When I did my last presentation in February before crazy world happened, we were about the 7th practice in the United States to have it, and they didn't know when anybody else was going to get it after us. So I don't know what the number is at now. I know they weren't shipping any out during the closure of most places. So my understanding is there's still very few out there, okay? So this is Allergan's answer to Emsculpt. That's what it is, okay? So what does it do? It tones, contours, and lifts, okay? So it's different than CoolSculpting. CoolSculpting is what freezes fat, okay? CoolTone is what I love because I don't have time to work out, right? So it's gonna tone. It's off-label for arms, but we're gonna find a way how to do that on me. So you can CoolTone on label, abs, booty, thighs, okay? And I just wanna get in the whole CoolTone machine, but there's not one, right? So muscles get firmer. I think that's really important. And the buttock gets firmer and lifts, okay? So as we get older and we kind of, for lack of a better word, get that pancake booty, right? It lifts that back up into place. And there's some pictures here. So basically it is a paddle and it sits on the treatment area, okay? And it contracts muscle. That's what its job is to do. So it contracts muscle while it just sits there, okay? So it bypasses the skin, the fat, the nerves, targets the muscles, and creates powerful muscle contractions to tone and strengthen. Applicator applied, what we talked about, you'll feel muscle contractions. It's 30 minutes. So when we do buttock or do thighs, there are 2 applicators, so you don't have to do thigh. It's at the same time. If we can fit 2 paddles on your abdomen, we'll do 2. If we can only fit 1, we do 1. All right? All right, the 3 areas we already talked about. So it has 50% more magnetic intensity than the leading competitor. I've already mentioned who the leading competitor is, okay? It is Emsculpt, and basically there's always been an argument between who's better, CoolTone or mSculpt. It depends on which study you read, okay? Allergan has done a lot of studies, and I will tell you that CoolTone works, okay? I've been on CoolTone. It feels different than mSculpt. Yeah, mSculpt is very, very popular on the coasts. Yeah, very, very popular on the coasts. Okay. We can go through this if you want, basically about conduction and how the current works. But the reality is we put a paddle on, it contracts your muscles for you, okay? Contraindications, what will happen afterwards? With mSculpt, the next day, you will have quite a bit of pain and tenderness. The reason CoolTone doesn't really have that, so you can imagine if you sat there and contracted your muscles thousands of times, right, in 30 minutes, it would hurt. But CoolTone has something a little bit different than the competitor. They do a tapping. And what the tapping does while you're on the machine is it helps to release the lactic acid that builds up when you contract muscles, okay? So when you're working out, you are building up lactic acid in your muscles. That's what hurts the next day when you get lactic acid buildup, okay? That's what causes those cramps, Charlie horses and racers, triathletes, etc. CoolTone has a special mechanism where it taps and it releases that lactic acid. So when you wake up the next morning, you don't feel like you just did 10,000 crunches, but you're going to look like you did, okay? So who is the right candidate for this? Somebody that has a low BMI, okay? Somebody that really is looking for muscle definition and lifting of the buttocks, all right? Same here. So you can see you're going to get toned. That's the point. Ooh, I don't think I have my mom's picture in here either. My mom's pictures are great. I don't think I uploaded them. Darn it. My mom is 70 and she did CoolTone. Her abs are amazing. This is your first series. Yep. Then about every 3 months, you do just one, just to maintain it. Because obviously, if you're not working out those abs or that booty, it's going to go away, right? But it's not bad to go in the gym every 3 months for 30 minutes, if you ask me. Okay. On this picture, what you can see is, if you get close, if you draw a line right there at her buttock, the easiest thing to see is how it's more lifted, okay? And it's more projected and popped out, all right? Same on this one. If you look here at the line down here, if I draw a line all the way across, you can see, you can imagine this is the pancake booty, and up here, it's the bottom is lifted up, and she is more, oh, yay, that's awesome. I will show that. Thank you. How this is lifted and popped out instead of that flat, okay? There's other ways to get that projection that we do here, such as PRP injections and sculptor injections, but that's not gonna give you tone, okay? That's gonna pop out your booty and give you kind of that peach, but it's not gonna make that muscle stronger, okay?